talk about feeding a patient, which sounds easy and sometimes requires a whole lot more dexterity than you think. Okay, so let's think first about our patient. We're lucky we've got Emma sitting in a chair here. Often your patient will be in a bed. Of course, with bed mechanics, you can bring up the head of the bed and help them sit up. Unfortunately, at least 50% of the time, the patient is too far down the bed, so that when you bring up the head of the bed, all you're doing is bending them somewhere here instead of at the hips. You will need to actually ask for some assistance to reposition your patient so that you can get them sitting nicely. Now, as I said, Emma's nicely sitting up in the chair. Hello, Emma. Hi. We're going to help her with some food. Now, we'll just talk briefly about personal protective equipment in the hospital. Probably, especially at the moment, for feeding, you will probably want to put on gloves and protective eyewear. We're at home at the moment, so we're not going to worry about that too much. Let's talk about finger positioning. We've done this in our tutorial this morning. We're talking about, Emma, I'm going to put my fingers just gently on your throat, okay? So ideally, you want to be able to feel just up into the soft triangle under the jaw here, so that you can feel those muscles. Next finger sitting on the thyroid cartilage, on the Adam's apple there, that's it, got it. And the next finger down on the cricoid. All right. So Emma, just have a swallow for me so I can check that I can feel beautiful. Okay, so I can feel that nicely. Now, your position in relation to the patient is a tricky one. Sometimes there's room to pull in a chair and sit next to the patient, which is always nice. Sometimes there isn't, and you're going to have to stand up, which is a little more awkward. We just have to play it by ear. You're going to need to learn to be able to do this from either side, because sometimes your patient is positioned in a way where you can only get to them on one side. So from this side, of course, I can use my right hand to have a little feel. Thank you, Emma. From the other side, it's probably easiest to use, sorry, that was my left hand. Probably easiest to use my right hand from this side. Okay. Now, of course, you can do this upside down and use your other hand, your non-dominant hand, and have your pinky finger upwards. But people tend to find this is a little more awkward and a little bit more difficult to interpret. So maybe you want to be always feeling with your forefinger upwards. Okay. Now, with feeling how someone goes when they swallow, it's easy if they can feed themselves. Emma, can you take a spoonful of that one for me? There it goes. Easy. All right. It's not so easy if your patient can't feed themselves. And this happens all the time. We have patients with hemiparesis, we have patients who are confused, we have patients who have arthritis. They need a bit of help. So you're going to have to learn how to do this where you've got lots of things to do and only two hands. Using a table is always a good aid. Pull across the bedside table, position it. I'll help you with that if you need help. All right, so Emma, this time I'm going to actually help you because it sounds like you're going to need a little bit of assistance here. I'm going to put my fingers here, all right, and I'm going to do with my other hand, helping you out. Well done. So I can be crossed over a little bit. We can do it from the other side as well. I suggest you practice trying from both sides at home. So I'm getting my fingers in position. Here we go, Emma. Great. Okay, looks easy, give it a try. Now again, with drinking from a cup, it's very easy if your patient can pick up the cup themselves. Emma, would you like to just have a sip of water for me? All right, super easy, but not so easy if she can't do it herself. Now let's just say that Emma has a weakness in this hand. All right, Emma, I'm going to help you to hold the cup. Now the reason I want Emma to have some control over the cup is that it's really horrible to have somebody lift up a cup to your lips and pour liquid into your mouth when you've got no control. This is a way of ensuring that Emma gets some control and she feels like she's got the chance to be the boss a little bit. Okay, I'm helping you lift it up, Emma. Here we go. That's it. All right. So you can see this is hand over hand assistance. I'm providing the support. Emma's just being the driver of when she wants to start and stop. Okay, thank you, Emma. Now, of course, if you have a patient who can't hold the cup for themselves, as soon as you leave, some nurse is going to say, well, why don't we just give them a straw? No? Now, yes, that makes some logical sense, but we all know that drinking from a straw is a different matter. So if you have a patient who can't hold the cup for themselves and can't control the cup for themselves, I always try them with a straw so that at least I can say with authority, no, that's a really bad idea if I think it's not going to work. So Emma, we're going to go again. I'm going to hold the cup for you. You don't need to worry. Here we go. Thank you. All right. Emma coped just fine. I would be happy for the nurses to offer her a straw, but just remember, that's not going to be the case every time. Thanks. Thanks, Emma. You can eat.